Welcome back to What's New in the Lou with Alexis Zotos, presented by Caldi's Coffee and recorded right here at Bucket List Podcast Studios. This is your can't miss weekly podcast, bringing you the latest restaurants, the can't miss events, and of course, the people that are making our community the best place to live and visit. And at the end of each episode, we are bringing you a calendar of events so you know exactly what's going on all across the St. Louis region for the week, so you don't feel left out when you see it all on social media. And this month, of course, is Breast Cancer Awareness Month, which is why I'm thrilled to have our guest with us, Dr. Tish Singer. Thank you so much for being here.
Thank you for having me. I appreciate it.
So you opened Shero Imaging this summer.
Yes, it's my sixth child. Yes, it's my sixth baby.
Love it. Love it. Why did you decide that this was something our community needed?
So I worked for many healthcare systems over the years, and I've worked for the major healthcare systems in the area. And it became clear to me, I also love leadership positions. And at some point, it became clear to me that healthcare has become less about patient care and more about achieving metrics, about, how do I say this delicately? It's not so much about taking care of patients as it is about
the numbers game?
It's a numbers game. Yeah. Yeah.
So what makes Shero Imaging different?
So I remember I grew up, my dad was a doctor himself. And what I loved is that he spent one-on-one time with his patients. And I realized at a certain point, as 50 to 60 mammo patients were rolling through a day, I didn't get to talk to maybe 5 of them I got to talk to. I realized that I missed that patient interaction. And I always thought I'd be a doctor and I'd see patients and I'd provide patient care and talk to people. And I wasn't really getting to do that simply because, like I said, the numbers game, you have to see X amount of patients in a day to make money. And that became something, I became really burnt out with what I was doing and really, I didn't enjoy my job much anymore. And I thought about, as a woman who actually undergoes regular medical care, how I would want it to look when I was getting my own mammogram. And so I decided to change the game and do it differently. So Shero Imaging, you see a doctor every single time you get a mammogram. You get personalized screening recommendations. And I think people really love it. It's different. It's new and it's different.
And so what was the process about I want to, before we dive into more about why this is so important, I'm so curious about, the process of building this business. You've been in, whether it's a business or, you know what I'm saying?
Of course.
Because it is a business.
Of course it is. Yeah, sure.
How did you decide, okay, I'm going to break away from sort of the big ones and create this more personalized thing for people who are in need of mammograms and care? How did you go about figuring out how to do that?
It was really hard. There's no manual for doing something like this. And quite frankly, large healthcare systems don't want to see this happen.
I would assume so. Yeah.
Actively against people like me in the system. It's been terrifying to do it. Again, there's no guidebook for doing it, but luckily I've made friends with a lot of doctors who are also stepping outside the system. There's actually a whole network of independent doctors in St. Louis. And that's been so valuable. And it's really given me my hope back and has given me the passion back that I have for practicing medicine. It's been a huge game changer. And that kind of propels me forward to do what I want to do and to give great breast care to women.
What do you think makes your office maybe easier for someone to come in and get that mammogram, where a lot of people, they put it off? Let's be real.
Of course.
People are scared of it, even especially if they've never done it before. How do you hope to change that feeling, that emotion?
So it's going to change right away from when you make your appointment. When you make your appointment, you can either click online to make your appointment or you call and you talk to a person. There's not a phone tree where you have to select 7 different options to get to a voicemail where you leave a voicemail and then somebody calls you back and you play phone tag with that person. And after 16 phone calls, you perhaps have an appointment. You talk to a person. You walk in my door, you talk to a person. You come in. You don't have to wait. I'm never 45 minutes to an hour late. I'm going to see you right away. I'm going to get you in and out, and I'm going to talk to you and give you your results. And My office, I've been told, is a spa-like environment. So there's no waiting room. There's a Zen room. It's quiet. There's a water feature. It's comfortable. There's lots of fun little snacky snacks because, everybody needs a snacky snack.
Always.
And I just wanted to be a more personalized, more caring, more compassionate way to deliver really, really good care.
Mm-hmm.
So it's different in every way.
So let's talk about the importance of women scheduling those mammograms.
Sure.
I am someone who has breast cancer in our family, so I've been getting them for a couple of years now. What is your message to women who are listening to this, who maybe are reaching that point where they're supposed to be getting their mammogram and they still haven't scheduled it? What's that message?
Please, please, please think about breast cancer screening. The recommendations right now are start at age 40 and get a mammogram every single year. Personally, and because I have my own center, I can do what I actually think is better for patients. And I think you should start at 30. Start younger because cancer doesn't care that you're 40. Cancer comes when cancer comes. And I've seen so many 20 and 30-year-olds with aggressive breast cancers where if they would have had a screening mammogram, it wouldn't be in their lymph nodes. It wouldn't be stage 3 or stage 4. So start as early as possible. We have different methods of screening at Shero. So we've got mammograms, we've got contrast enhanced mammography. The only other place in St. Louis to do that is Siteman Breast Center downtown. So we have that. And that's the preferred method of screening for women with dense breast tissue.
Yeah. So what's the difference? What is that? Like, what is that? Because that's also one of the reasons that density is, my understanding is why it's usually later that they recommend us getting it.
Yes.
Because our breasts are denser as we're younger.
Yeah. Absolutely. So when you're younger, your breasts are denser. The two great things about getting older, one is that you just don't care about what anybody says anymore. And two is that your breasts get a little bit less dense. So 50% of women have dense breast tissue. And as such, you're going to get a letter in the mail that says you have dense breast tissue. Your mammogram looks fine, but you may just want to consider some other kind of screening. Up until now, we've been doing these whole breast ultrasounds, which we still do, and I still think is a great way for women to screen with dense breast tissue. But now we know that some sort of contrast enhanced examination, whether that be a mammogram, whether that be an MRI, or whether that be a CT, is kind of how we prefer to screen women with dense breast tissue. And sadly, insurance doesn't really cover that unless you're high risk for breast cancer. So there's a real gap in care, and we're really not doing much in the community to address that gap.
So what is the way forward in terms of that? Especially, when people hear we should be starting at 30. I mean, my insurance, I remember started covering mine when I was 30. I'm 37 now. And I think I started maybe 2 or 3 years ago. And mine covered it. And I was surprised. I remember I was like ready to like argue, and they're just like, oh no, it's covered. I'm like, great. So I do think people don't even realize what their insurance might cover.
Correct.
But what is your advice for people who are like, oh, I don't know. I don't know if it's going to. How do you help people navigate that?
So one of the things, for Shero Imaging, our tagline is be the hero of your own healthcare. And one of the things that's really important is in your healthcare journey, you absolutely have to be an advocate for what you want and what you need. And there is nobody that's going to be a better advocate than you. So if you want to start screening early and talk to your insurance company, see if they cover it. And if they don't, step outside of the insurance. A lot of times people don't even realize it might be cheaper to get a mammogram not covered by insurance versus covered by insurance.
Interesting. You mentioned your dad was a doctor. Is that how you decided to go into the medical field? What drew you to it?
Well, actually, no. He was a kind of a dentist doctor. So he was an oral surgeon. And I was grossed out by all of that and said that I wasn't going to do that. And he always told me I should never do that. And then, of course, in college, I decided to rebel and thought about doing it, but then I didn't. So I didn't go to medical school until I was in my 30s. I took some time off, and I realized I kept putting it off and delaying it, but that was really what I wanted to do. So I did it.
And what field did you immediately, what was the field that you initially were kind of drawn to?
So I always thought that I'd either be an OBGYN or be a pediatrician. And I loved every rotation I was on except for surgery. Sorry, surgery. It's just not my thing. I don't love the operating room. But what I realized is what I really liked was definitive results. And for me, I actually went into being a radiologist. That's what I am. I'm a radiologist, and specifically a breast radiologist. I always knew I wanted to work in oncology of some sort, but I couldn't do oncology because I can't emotionally handle that on a daily basis. I still am in that field and I still do deal with that on a daily basis, but in a different way, in a more comfortable way. And I like where I am.
How have things changed from a breast cancer standpoint since you started in
Yeah,
this field?
great question. So breast cancer screening is a new thing. It's
Mhm.
not something that's been around since the 50s, 60s. We started doing this in I think the late 80s. So breast
Okay.
cancer screening is not, a field that's been around forever. And as such, it's a field that evolves very, very quickly. Um, I watch technology continue to kind of lead the field, take over. And the other reason why I left traditional healthcare was I really didn't feel that large healthcare systems were able to kind of shake and move as fast as technology is moving and
Mhm.
move forward. A great example is contrast enhanced mammography. We know damn well that that is actually the best way to screen women with dense breast tissue,
Mhm.
but you don't see it in places where it should be. It should be in every large healthcare system. And
Mm.
why is it not there? It doesn't pay well for insurance. That's why it's not there. So it's not the best. Oftentimes, healthcare is not the best for its healthcare participants or patrons. It's
Mhm.
what the insurance companies and healthcare systems want to provide. And that's been an eye opener for me because I went to medical school to serve people and to do the best that I could to serve my patients. And it's been eye-opening that the healthcare system isn't really set up to do that as well as it should, and it's
Yeah.
sad. I
Yeah.
don't like that.
No, it is frustrating, especially when people don't know enough to maybe do their own research, find out what our options are available, and but that's sort of where these more is boutique
Yeah,
the
boutique
right?
is a great way.
Okay, okay.
Boutique, concierge, I'm okay with any of those terms. I believe that's becoming more and more popular because
Mhm.
so many of us inside, big healthcare systems just have decided this is not the way that I wanna
Mhm.
do things, and kind of wanna go back to more personalized care because healthcare is really depersonalized right
Mhm.
now. I mean, you are just a number. You are a medical record number. We're chugging you in, chugging you out every 10 minutes. You're lucky if you get to shake the hand of an actual doctor in an appointment.
Mhm.
It's different these days, and it's not the way that it was supposed to be.
Caldy's Coffee has been proudly roasting in St. Louis since 1994. Guided by a commitment to quality, service, and community, Caldy strives to make every cup a moment of discovery. And get this, thanks to the support of their St. Louis community and fans across the country, they were named USA Today's #1 coffee chain in 2024. Visit caldyscoffee.com to find your nearest cafe, shop coffee for home, or even book a free tour and cupping at their roastery. Follow the goat to your next great coffee experience. Enjoy the rest of the episode. Do you feel that we are, aside from sort of that aspect, are we moving in the right direction when it comes to fighting breast cancer?
I think we're getting there. I think there are a lot of heroes out there fighting for breast cancer screenings to be covered, and they're heroes in my mind. There's Amy
Mhm.
Patel in Kansas City. I know Debbie Bennett, the head of WashU Breast Imaging here. They're fierce advocates for covering screenings for women, and they're doing everything they can. But they're fighting against entities that are going to win every single time.
Mm.
And those are big healthcare lobbyists and insurance companies and people that want to limit access to care that costs money. So again, it's something that I'm very proud of them for doing all of the things that they do, and I applaud them, but I'm just not sure that in our healthcare system that exists right now, it's possible to move forward in the way we need to move forward.
Mm. Because right now, what would be, in your mind, the
Mhm.
ideal situation?
Yeah.
Insurance companies be damned. What's the ideal situation? Every woman getting screened at X point in life. What's your thoughts on that?
In my fantasy world, every woman at the age of 25 gets a risk assessment.
Mhm.
You think about genetic testing if that's something that you want to or don't want to do. At 30, you start annual screening. And if you have dense breast tissue, you get that contrast enhanced screening, and you do that every single year. And that should all be covered. That's what I want to happen in my Candyland world. But It's not happening. And so we have to figure out a way for women to get the care that they need in a different way. And so that's kind of what I'm trying to do.
Yeah. And we know that breast cancer, along with a lot of other health issues, disproportionately affects women that are less fortunate, things like that, where that care is harder to get or the access isn't there. How can we as a community in St. Louis and beyond help ensure that there isn't this giant disparity?
It's so hard. I mean, a lot of it is just getting the word out and getting people to trust that, healthcare is made for people and not for people to make money and not for people to do experiments on patients. There's been a huge movement in this country recently, a huge distrust of healthcare. And that's really hard to combat. And, one of the things that I'm doing, I'm out on social media a lot talking about healthcare and trying to gain the trust of people because that trust is really, really broken right now. And I think as physicians, we all need to lean in, tune in, and start really engaging with people or else we're going to lose people forever.
Yeah. How do those conversations go, especially as we're talking about kind of reaching those women who maybe are at that age, but again, they're freaked out by it. And again, I was one of those people. I was like, oh, a mammogram sounds scary. It sounds painful.
Yeah.
Really wasn't that bad.
Well, not that bad. And there's other technology. So at my breast center, I have mammograms. I also have a brand new breast CT. It's the only one in Missouri.
Wow.
And essentially,
what is that? Yeah, tell us about it.
It's a table. You lay on the table on your tummy. Your breast goes in a hole. 7 seconds, you get, 360 degree, essentially a mammogram of your breast. So 14 seconds, we can do both of your breasts. There's no compression, no touching your breast, no squishing. What we really need to do is lean into making breast imaging less awful. Because can I just be frank?
Yeah.
If we asked dudes to go get their testicles compressed.
No, never. They wouldn't.
Right. It's not happening. But I think we've been complacent in accepting that this has to be uncomfortable and painful. We're not really putting the research dollars into figuring out things that aren't and figure out things that are different and better for women. And that's also one of the things I really want to do.
Yeah, because, right. Well, I'm saying it's not that bad. It's still not like a pleasant experience.
It's not. I mean, nobody wants to be manhandled. Like, you
right.
know,
And it's like, you got to like lift it up there.
You do. And
and it's awkward.
It's so
and
awkward.
And there is this fear, of course, of what could it say? What could it find?
Of course.
How do you, besides the, pushing people to get past the uncomfortableness, how do you encourage people to say, hey, you have to push past that fear, that anxiety, because if you don't, the alternative could be way worse.
I think that's important. I also think that giving people same day results is really helpful. So I think one of the things that people hate the most about mammograms is you go get the mammogram and you don't get results sometimes for a week or two.
Yeah.
And then you get some sort of letter or a My Chart message saying, hey, there's something abnormal. You got to come back. Now that abnormal could be a horrible breast cancer. Or it could just be some tissue shadowing. No big deal. But you don't know that. You have no idea. So sometimes women have to wait 3 months before they get answers to these questions. And that's something I have a problem with and I want to change and something that I can change.
Yeah. Yeah. So you do day of results?
Day of results. If you come in for a mammogram, you get results that day. If you need more imaging or a diagnostic mammogram, it's included in your screening price and it happens right then and there. So we can go from screening mammogram to biopsy and, God forbid, a potential cancer diagnosis in 48 hours instead of months and months. And I think that's the way women should be getting care, honestly.
What was the reaction you've received from patients when they realize that quick turnaround, that level of care maybe they weren't accustomed to or used to?
They're astounded. They love it. They can't get enough of it. And honestly, they just question like, why haven't I ever done this before? And it's great. I mean, again, as a doctor, I'm finally able to provide the care that I think women need and in the way that women need to get that care in a compassionate, kind, caring way. And I can treat people the way that I would want to be treated. I don't want to wait 4 months for you to tell me that I have a breast cancer that needs to be treated. It's, if we sit back and really think about it for what it is, it's kind of unconscionable.
Are we are we moving in a better direction, at least in terms of the awareness aspect? We talk about October being breast cancer awareness. The pink is everywhere.
Yes.
The ribbon is
Of
everywhere.
course, I'm dressed all in pink and red right now, for
But
sure.
at some point, do we feel like it's almost like not being seen anymore because people are so accustomed to it, or what? I don't know. Sometimes in my mind, I'm like, oh, we see pink. We like almost, it's just there now.
So, again, I said I'm on social media a lot, and I've seen, a lot of survivors coming forward and saying that they don't like October because it's called pink washing.
Yeah.
So that there's this pink washing, and, everybody wears beautiful pink, but the beautiful pink doesn't describe what it feels like to actually have a breast cancer and what it means to be a survivor and what it means to actually come out of breast cancer and survive after that. We don't address those things at all. We don't care for people after they've gotten treatment. And we still need a lot of work on those things. We are not anywhere close to where we need to be. And I hope that will improve with time. Again, I love October because it brings awareness to breast cancer, but I actually think October should be every month, every day of the entire year. I don't think everybody should wait for October to take care of their boobs.
Yeah.
Every single month is the time to look at your boobs and take care of your boobs.
Okay. So talk to us about what do people need to be doing every month to make sure that they're at least aware?
So again, there's lots of conflicting literature about self-breast exams. I'm a huge fan. Why not touch your own breast? You're in the shower every day, you're laying down, you have sex with a partner. Feel your breasts. If they feel abnormal, if something feels different, you have a lump or something feels different than what it felt like before, address that. Address it. And again, I find so many women that come in and say, yeah, I've had this bump. I wasn't really worried about it, but it keeps getting bigger and I kind of put it off because I don't want to know what it is.
Right there. That's that anxiety that people feel around so many aspects of healthcare.
And then healthcare doesn't help because you call to get that appointment. Again, you have to have 16 phone calls before you actually talk to somebody. And by that time, you've chickened out or checking that lump. Part of it is just being able to get in quickly to get that taken care of and get somebody to listen and get somebody to validate those feelings. Because often as women, people don't validate the things that we feel. They tell us that we're hysterical and crazy and, you're just making that up and you're super emotional, all of those things that I just love that people say about women. And none of those are true. We're the best advocates for ourselves. And you know what? You think something's wrong with your body, you know your body the best.
Okay, so monthly
self-breast exams.
Self-breast exams.
At age 25, find your risk. You can do it online. You can come into Shero. We can help you with that. Know your risk. If you're at elevated risk for breast cancer, start breast cancer screening early. Please, please, please start.
What is your advice to maybe the person listening? Maybe they're going to talk to their mom. Maybe they're going to talk to their sister, their aunt, that person in their life who they know is creeping up on sort of that age. And what's your message to them to help them have that conversation with somebody who has been hesitant?
We can make the experience less scary. So I cherry-picked and hand-picked all of my amazing staff. We all work together to make this experience as pleasant and as not scary as we possibly can. You're going to walk in. You're not going to know you're in a breast center. You're not going to get in some scratchy gown and wait in some plastic chairs with 50 other people with people crying. That's not what you're doing here. It's like you're going to a spa and you're having a little treatment. It just happens to be a little breast treatment. And we'll take care of you. We'll tell you results the same day so you don't go home and worry about something. And then you can go home and you know what's what. You know what you have to do, and you have a clear plan for screening in the future.
What is your hope with Shero Imaging? I mean, as you talk about it right now, it sounds like if you got as many women to come in as you would like to, you couldn't possibly do all those same day results or provide that. So what's the hope? Expansion beyond what's your goal with Shero Imaging?
I hope to set up more of them and have more of these places where women can go to get compassionate healthcare. So that's my goal. But right now it's just me and my, breast center, and I'm happy with that. So I would just be happy being in Shero forever.
Do you see an increase in calls during October?
For sure. For sure. Calls have tripled just in the last week. For sure. Yeah.
And as we head through the rest of October, as people see those pink ribbons or they see the pink XYZ that some company has put out, what do you want people to remember the most?
I want people to remember the survivors, the women that are still fighting breast cancer that are out there, the women that have fought their battle but still continue to fight. Just because you are in remission doesn't mean that your battle isn't over. Those scars are still there. And I think that as friends, as daughters, as mothers, as sisters, we need to lift those women up and help them and be there for them and continue to be there for them after everything is said and done. And I want women to think about their own breast health and to be less afraid of breast cancer. Breast cancer treatment has really evolved. I'm not saying it's perfect. I'm not saying that, you should want to undergo therapy, but I'm saying that it's personalized, it's different. It's not your mother's breast cancer anymore.
Mm.
Don't be afraid is my message. It's more scary to let something go and not deal with it. And then you have to deal with it and it's not curable and it's not treatable. And that's a tragedy. It doesn't have to be that way.
Amazing. Thank you so much. We appreciate it.
Thank you for having me.
All right, you heard Dr. Singer. Put it on your calendar to get those screenings scheduled. And now let's dive into what's going on across St. Louis this week. Boo at the Zoo kicks off October 16th. It'll go through Halloween. Pines Fest, if you listened to our episode last week, that is Saturday, October 18th. Oktoberfest at Westport Plaza is Friday and Saturday, October 17th and 18th. Pumpkin Festival on Main Street, St. Charles is Saturday the 18th. And also in St. Charles, Legends and Lanterns happening on Saturday and Sunday, October 18th and 19th. Thanks for listening. Don't forget to subscribe so you know exactly what's going on in the Lou each week.